So welcome everybody. I have the distinct honor of inviting our speaker, Jackie Odhiambo, to speak today. She is a public health and health systems researcher, and she's currently pursuing her PhD. Many of you know Jackie already, but I'll go through the bio to just talk about her impressive credentials to speak today about widows. So I'm really, so she's, in addition to pursuing her PhD in public health, she's also a PhD fellow at Macedo University through this program. She's also the founder and executive director of, Jackie, can you help me with the pronunciation? Nyanam. Nyanam, thank you. Nyanam Widows Rising. She's the founder and executive director. Nyanam means daughter of the lake. Widows Rising provides widows in the Lake Victoria region with leadership education, personal and professional development. It was founded in 2017 and helps widows begin micro enterprises and small businesses, and educates widows about property rights and helping them to reclaim what's theirs. They have built homes for widows whose safety was threatened, and nearly 1,000 children have benefited from their youth camps and mentorship programs. Hundreds of widows gathered for monthly meetings, providing them with a sense of community. Welcome, Jackie.
Thank you, Rachel. Let me put up share my screen. I hope that's visible.
Perfect.
Okay. Yes. And so the only thing to add to what Rachel has said is that I've also been raised by a team of widowed women, and it's a personal growing up experience that definitely has shaped where I am and what I'm doing with my work. So thank you again, SD4H Forum, for the opportunity to share today. I think we have a lot to cover, so I'll just see how it goes. But I wanted, first of all, to just start on a light point. Who knows the name of this creature? You can just shout it, or Rachel, I'm not able to see the chat, so maybe you can monitor that for me. Oh, I can see Black Widow spider. So yes, people got it. So it's a Black Widow spider. I think the first time I was doing research on widows, and I would go to PubMed and Black Widow spider would show up, and I'm like, what is this spider and why is it called a widow? And so the spider is named widow because some scientists noticed that the females would eat their mates after copulation. I won't say much, it's just something to think about. But then in nature, it's only 2% of female spiders in these species just that have the cannibalistic behavior. So why widow in the name, if only 2%? Food for thought. But for today, this is the outline for the conversation that we're going to have. The beauty of this conversation is that we are all, and especially those coming from Kenya and Africa, experts in one way or another on this topic. But so the outline will be this. First is just understanding who a widow is, and then thereafter we'll see some health disparities compared to widows and other demographics, and have a conversation around what is stigmatization of widows and what role could it be playing in the health disparities, and then end sort of on thinking about what solutions can we put in place. So that is the outline, and then there'll be a lot of questions, so hopefully people are up to participation. So who is a widow? I'm able to see the chats now, so feel free again to just put whatever you have in your mind in the chat, or if you want to shout it, that's okay too. But who is a widow? I think probably it's a question that maybe we may take for granted and just say, well, everybody knows who a widow is. So who is a widow? I'm waiting for the first answer, and then we'll pick that up to continue the conversation. A woman who was married and her spouse dies. Craig is the most active participant so far. Craig, sorry, I didn't carry chocolate, but probably I should follow the trend of Dr. Bukusi to have chocolate to distribute later. Evelyn also says a woman who has lost her partner. Thank you for that. Oh, so people are typing. Thank you all. Maybe it's my internet also. A lady whose spouse has died, Ochomo. Someone whose husband or wife has died. Dr. Memo says, woman who has lost husband through death. Thank you all. Those are really good responses. And my role will be sort of like to complicate that a little bit. What about if she remarries? Does she still have the title or the label, or does she still belong to the social category of a widow? And what about in the cultures where we have the practice of levirate marriage or widow inheritance, as we commonly call it? If a woman is inherited, is she still a widow? So complicating it a little bit further, what about women whose husbands disappeared, for example, let's say in war, and they've never seen them, they do not know where they are, whether they're alive or not? I have seen some activists in around at a global level who are trying to advocate for widows, call this group of women half widows. Do you agree? Is that defining? Is calling these women half widows definitive enough, or what do you think about that? And then there's also one experience that I've been hearing a lot from women whose husbands are alive, but they say their husband has neglected every type of a role that either they would play as a husband or as a father. And I've had one woman say something like, my husband is as good as dead. So even though he's alive, I feel like I am a widow. So experiential widows, I don't know. So what do you think of these other categories of women who, through their experiences, are either calling themselves widows or are being called widows in the context where there is no death of a husband? And then the last part to also kind of complicate this is, so once, which I think relates to the initial question of what if a widow remarries? Are they still a widow, or they now change their marital status and be, or their social category changes definitively? So once you become a widow, are you always a widow, or is widowhood temporary? So this is just to complicate that definition that we normally have of a widow. And again, feel free to chime in if you feel like this is getting too confusing, or is, probably something that you're beginning to connect with. Feel free to chime in, but I'm gonna move on. So yeah, so then a widow is not just, someone whose husband has died. There are a few other aspects of women's lives after the death of a husband that we need to consider when we think about widows. So here's another quick question. Feel free to, again, put something on the chat. There's 4 options, A, B, C, D. We now have 55 million people in Kenya. What proportion are widowed women? Just have a guess. A, B, C, D. I see Dano Molo has a question. I don't know, Rachel, are you able to like track for me the questions that are being asked so that later on we're able to go back to those?
Sure.
Yes, please. For the questions, please track that for me. So Anke says 4 million. Chemtai says 8 million. Rachel also thinks it's B, 4 million, 7.3% of Kenyans. There are many options, choices for B. Yeah, so B kind of takes the lead. I'm gonna also kind of agree with B, but with the caveat that we actually don't have the data to public data to confidently say that there are 4 million widows in Kenya. I'm leaning on 4 million also because there's another organization in Nairobi that serves widows that did some survey. I mean, their data is not public, so I haven't seen it, but I've seen them talk about their report and saying they estimate it at 4 million. But the problem also with understanding even the population of widows is that we do not have public data, at least in Kenya, on this. So we had census, for example, in 2019, and the data is reported by other demographics characteristics such as age, gender, but not marital status. And I'm not sure why, but that is the situation, and it kind of is something that cuts across a lot of African countries where data on population of widows is not, or on marital status is not sort of a public record as such. So on to just a little demographics about widows. Some of these are coming from a report that was done in 2015, so the data might not be as current, but there's a significant report on global widowhood that was written by a UN affiliated organization called Lumba Foundation. And in that report, they estimate around 245 million widows globally, 24 million widows in Kenya. And then this 4 million, of course, comes from that data from that local organization that I mentioned. And then oftentimes widows, especially those coming in from, if you think about global north, global south, or I don't know what categories to use in terms of, in this OECD report, they used high income countries, least developed countries. And the graph, this graph on the top right shows the differences in age distribution. So for example, you have much older widows, 60 plus years in high income countries, and you have more younger widows. For example, in least developed countries, you can see the green bars are longer in, and those are for the least younger widows in least developed countries. So the issue about, so even though, yes, regionally across the world, widows are more younger in our context, like in Africa, in Kenya, but even now when you come to within Kenya, you'll find that on average widows are relatively older than other groups of women. So for example, the table 1 that I'm showing here on the bottom right, this is from a paper that we just published just this last month, and it was based on Shamba Maisha, a trial that we've talked a lot about, we've had a lot about in some of these forum. And you can see here, when you look at age, widowed women in that trial, on average, the mean age was 42 years compared to 35 years for the married women, and there was a significant difference. So within each country or each community, on average, widowed women are going to be older. Also to notice that they are often the household heads. I mean, by default, we see that. And in this study, 97% of widows identified as household heads compared to 10% of married women. And from other statistics, in terms of literacy, from the same study, you can see around 80%. This was similar for married women, and widowed women had completed primary education or less. So that is just to get to know more about the demographics of widows. But widows are sometimes can be easily seen as, single adult women, single mothers, but they're not the only single women or single adult women. For example, we have women who are separated from their spouses, women who are divorced, and oftentimes widows, separated women and divorced women are grouped together and called female heads of households, or even ever married women. So the question is there any issue with this grouping of different categories of single adult women? Of course, one that is not here is single adult never married women. But do you see any issues with this kind of aggregation and analysis that puts them all together as female heads of households, or even ever married women, or single mothers, or single adult women? Any thoughts? I'm gonna go back to find the charts again to see what thoughts. I mean, maybe there are benefits, maybe there are no issues with the grouping. So maybe, what thoughts you have on the advantages or disadvantages of these aggregated analyses. Oh, I know what gift to give. For those who are in Kenya, this is gonna be true. As I'm waiting for responses, someone at the end of this is going to be the judge for the most active participant. But there's this little book, I know you can't see it well, that has, it's an anthology with the stories of widows, and we'll find our way to get that anthology to someone in the forum today. Any thoughts around aggregated analysis of the different groups of single women? Yes, I can see Anke has a hand up.
I just have a question. So I understand the aggregation, but I would imagine it's their latest status, right? Let's say someone was separated from one person and got divorced from the next person and then was widowed in the end from a third person. That would only count once in here, or how, or is there, or should there be a composite group too of women that share several of these experiences?
Yeah, I mean, that also is a important issue you raise, Anke, around because marital status is also not a permanent oftentimes. I know and I raised that question earlier, is widowhood permanent or temporary? But it's something that changes over time. You can be married and then widowed, then married, then divorced, then and I think for these kinds of analysis that aggregate, they consider what you're reporting at that time, because oftentimes this is self-reported. And so how one identifies at that time of being questioned or is how it's often recorded. And the challenge, so that's kind of one challenge in terms of you don't track the changes over time, and that you can only do if probably you did a longitudinal study and looked at recorded marital status over time. And I see Chemtai also says they likely face different issues, yes, challenges based on history. So that's also something to acknowledge. And a few thoughts that I also had, I think sometimes the aggregation makes it easy for data collection, and also easy in the sense that sometimes to even self-identify as a widow can be a stigmatizing experience. I know from maybe the census data in 2019, somebody was reflecting on it and saying in the slums, women who are widowed didn't want to report themselves as widows. So they would just report themselves as single women. And as a result, even now when you want to have a sense of what proportion of women are actually widowed in the country, then you'll be underestimating that proportion, or who have ever experienced widowhood, you'd still be underestimating if they're not reporting that. And a divorce can also be something like that, of feeling the stigma of sharing that one is divorced. So there is that. Oftentimes for the studies that I've seen, there's always a aggregation. I mean, if you look at KDHS and other studies, there's always aggregation of maybe widows and divorced and separated women. And sometimes it's a sample size issue at the time of analysis, based on how sampling was done and how many of each of these groups you end up having, and whether it makes analytical sense to group them together or separate them. But what Chemtai, you were saying, is now the differences, social, cultural, historical, health, grouping them together would mask those differences. And something else that I've seen in the literature is that for female heads of, if you use female heads of households as the category for when you're collecting the data, or then sometimes it's a household where the husband is migrant, they're somewhere else doing work, and so there you're actually having a married woman sometimes put in as female head of the so sometimes you have those cases where in the household there is a husband, but they get up grouped, confused. When you think about female heads of household, you're thinking about the single women, but this is not a single woman. So those are some of the challenges with how we analyze or group the single adult women. So I'll go through this one faster. So for age categories of widows, this is also something to consider, is how do we define age category of widows? Who is a young versus who is an old widow? Is it based on the recency of widowhood? If a woman is 82 years old and they get widowed, is that a young widow or an old widow? Also, there's the biological part. I think a lot of data, for example, for the KDHS, there's always focus on reproductive age. And I've seen also for HIV/AIDS, when you talk about HIV/AIDS and aging, there's a trend around using 50 years as a cut-off point, so that 50 years and above, thinking about as those who are in the category of aging with the HIV/AIDS. Religiosity too plays a role in thinking about age of widows. For example, Christians tend to use 60 years as kind of the mark for older versus younger widows, of course, from some of what's written in the text around from what Paul writes about who to define truly as a widow 60 years and above. But then there's also geographic location. So for example, the average lifespan is much longer in the US compared to Kenya. And so the consideration of young versus old there also will be impacted by the lifespan of a country or a region. So that is the first part of our conversation in terms of just trying to understand who a widow is and the demographics. So up to that point, I'm taking a 1-minute pause. Does somebody has just a general reflection on what we've said so far? Let me see if there's anything in the chat. Okay. All right. So the next part I want us to walk through is just to look at this issue of health disparities, and we're going to do comparisons at 2 levels. First is between widows and widowers, and then the next part is among women, so looking at widows, married women, divorced or separated women, never married women, and just looking at a few health outcomes or health behaviors and outcomes. And the comparisons, the data I'll share are all from either the KenFIA report, Kenya HIV Impact Assessment report. The full report was released last year. The study was done in 2018. Or some data will come from Kenya Demographic and Health Survey that was released last year. And then, so I'll just walk through these different statistics, comparing them, and then after that, open it up for thoughts and discussion. So first, before we see the differences, widowhood is gendered. Marital experience is gendered. This graph comes from a report done by a group from World Bank, and just looking at across. So the x-axis has the ages from 15 to 95 years old, and then the y-axis is the proportion for each marital status. So I'll focus more on the married, which is the green, and then the widowed, which is the red. So the left you have male, the right you have female, and you can see that for the male, being married peaks, around the age of probably 30, 35. And then after that, it's sort of like, it goes down, but not as fast as the curve for the women goes. So that men, even when they're 65 years old, you'll find still at that age, over 80% of men are married. Now compare this to the women on the right. At the age of 65, it's around 40%, is it? Just above 40% of women who are married at that age. But then if you look at women who are widowed, for example, at 75, over 60% of women are widowed, compared to at 75 years, less than 20% of men are widowed. So you can see that it's the women who are living more of their years as they grow older widowed compared to men. Now, this ratio of widowhood, men to women, I took some statistics also from KDHS and KenFIA reports, and you can see from these two reports, on average, for every one widower, you have about 7 to 8 widows in Kenya. But also consider that the age limits here, one report only considers people 15 to 49, another one 15 to 64. So it doesn't even cover the whole spectrum, age spectrum, which would probably mean this ratio is even higher. So the question then is, why are there more widows than widowers? Any thoughts? Why do we have more women who are widowed compared to men? I see Anke is asking, what is the average age gap in a couple? Are men that much older? Anke, for one, it's sort of like men marry when they're older compared to women. Women marry when they're younger. So women marry younger than men. Craig has shared that. Also, women live longer. So those are some of the reasons. Any more thoughts? Bethany says high HIV deaths in men. Yes, thinking about care-seeking behavior, and we know that women have better care-seeking behavior than men. Ochomo says polygamous marriage. Yeah, one man with multiple wives. And now that's a question, Ochomo. Hopefully you'll have an answer for us. If a man who has married multiple women, one wife dies, is that man a widower or not? Ochomo is asking. Also, Dak says it's easier for men to remarry, which is very true. Our culture here. Yeah, Dr. Memo also says the death rate for men in Kenya is high due to a number of reasons. And Inga also reaffirms men remarry much more often. So thank you again. All of these answers are right. And Dr. Memo, I was trying to find causes for death. any recent statistics on causes for death, and maybe I haven't done enough such, but that would also be interesting to look at, you know, sort of the current data on that. But you all have answered these questions very accurately. Oh, Jackson Limos says men are risk takers, therefore most of them die. Yeah, what kind of occupation? For example, men are oftentimes, there's more men, for example, in military than, or even in the rebels, you know, these different types of either occupation or just activities they get involved in that are high risk. So thank you all. I think you've covered everything that was also in my list. So let's now look at sexual behaviors, comparing widows and widowers. These from the KDHS widows. So the gray graph, the gray bar is widowers, and then the orange bar is widows. So that's how we are doing the comparison. And then you can see that there's more widowers compared to widows who are having multiple sexual partners. And then among the sexually active, those who had casual partner in the last 12 months, there is a little bit more widowers than widows. I really tried to find the numbers for like, of the widowers, what proportion are sexually active, or of the widows, what proportion are sexually active, but those ones were not there in the report, so we're not able to look at that. And then also for condom use, very small difference between widowers and widows. Then when you look at HIV prevalence, then you see a bigger difference here. For women, for people aged 15 to 64 years, 26% of widows are HIV positive compared to 13% of widowers. But when you then lower the age group and have it from 15 to 49 years, then you find the reproductive age category, then you find much more widows, 35%, which I think is the highest prevalence of HIV in a particular group in the country. Probably only, I don't know if female sex workers might be a little bit more, but I know from like this proportion is higher than men who have sex with men, people injecting drugs and stuff, other key populations. So this prevalence is much higher for widows compared to other key populations. Also, when you look at health disparities, you find, comparing widows and widowers, you find widows are bearing a greater burden, for example, for vision, hearing and mobility issues, ever experienced physical violence. From this data from KDHS, they found that widowers actually reported more sexual violence in the last 12 months compared to widows, which is something worth investigating earlier. Then I'm gonna move quickly to comparing widows and other categories of women. Again, when you look at sexual behavior, you find that widows, in the last 12 months, widows reported more, the proportion of widows reporting 2+ sexual partners was higher, more than 2 sexual partners was higher compared to married women, which is the gray bar, or never married women, which is a brown bar. And if you look at sex with casual partners, you can also see that a higher proportion of widows are reporting having had sex with casual partner in the last 12 months, but then a lower proportion of them compared to never married women used condom in the last sexual intercourse. So that's for sexual behavior. And then there's also the aspect of gender-based violence. And here too, you can see that ever physical violence, ever sexual violence, the proportions are higher for widowed women compared to the other categories of women. Then when we look at HIV, sorry? Okay. When you look at HIV prevalence, now bringing the same data for widows and comparing it with the other groups of women, you can see again that the prevalence is much higher for widowed women, even for reporting having syphilis. But when you look at STI diagnosis in the last 12 months, it's actually the divorced women, divorced and separated women, a higher proportion of them reported having a newly diagnosed STI in the last 12 months. Then the disability part too, there's a similar kind of a trend where widowed women are bearing a greater burden in terms of the proportion among them who either have a specific impairment, communicating, hearing, seeing, walking, or just in total inadequate. So all of these, I think I'm gonna skip this one, and I'll just say that all of these data is illustrating that widows are experiencing a greater disease burden compared to other group of women, and also compared to widowers. And this is something, this graph was reported in the same Lumba report that I shared, where they were asking the question of, to what degree are women in your country who are widowed treated worse than other women? And you can see Kenya was not included here, but if we use Nigeria as an indicator, 25% said a great deal. That is 1 in 4 widows being treated worse than other women. And then 33% said, to some extent. So here is now the question, and your inputs are highly welcomed. Why do widows have poorer health? And I know I have not shown enough on sort of like the economic, but focusing on the health outcomes compared to widowers and non-widowed women. Any thoughts? Again, feel free to, stigma. Craig is the first to answer. Craig says the stigma that is leading to this. What do other people think? Craig, I think you already got the anthology, so keep participating actively, but we'll look at number 2 to get the anthology. Anke said less household income, no family support. Thank you, Anke. Any other ideas why are widows experiencing, likely socioeconomically disadvantaged? Chemtai has shared that. Thomas Mawara says culture, and I think Thomas, I kind of want to put you on the spot if you allow me. Could you tell us more culture and why, and how that happens and what that means in terms of the health outcomes for widows? Yes, so Thomas says in the chat, though it's not common, but lack of inheritance means no or very little support. Anke says they may need to take more health risks to gain income. Inga says maybe correlation to being HIV widows. Inga, would you like to speak more about that?
Yeah, can you hear me?
Yes, very clearly.
Okay. Because the statistics on HIV, I believe they're high, then you find that the high prevalence in disease would be related to, would find some sort of correlation with being widowed from HIV. Those were my thoughts. Yeah.
Okay. So maybe greater burden of other diseases. You have HIV, so comorbidities probably is what Inga is, asking us to think about. Once you're HIV positive, then of course your immunity is compromised, and as a result, you're likely to also get other infections easily. Okay, so, and then Sherry says widowhood stigma, and then Dr. Memo says early marriage and early child bearing, which again, if we think of it from the life course analysis, I think Dr. Memo is pointing to the fact that there's a literature out there showing how early marriage also will have an impact on your health outcomes in the long run.
Yeah. Yeah,
Yes.
Jackie, I think the widow will be at some catch-22 situation, in the sense that if she doesn't remarry, again, from the point of view of, I think someone mentioned culture and the people or the in-laws or other, or just people around, it's like, she's now, prostituting. She's out there, she's satisfying herself through prostitution, because that's the belief. How can she be alone? She doesn't have a husband and she's just there, Again, if she remarries, then again it's like now, so there is always something to talk about, to talk about this video. So at the center of all this, somebody gets tired and can make any crazy decision that might harm.
Yes. Sorry, who was talking up? I wasn't able to see you.
Jackie, I want to say something in addition to what Charles is saying. I'm just looking at it from the other angle. Younger widows, for example, maybe they don't want to be alone, and so they become more vulnerable to deception from men because they're trying to find a place to belong to. And so it's easier for them maybe to want to get hitched with other men who also abandon them. And so in that way, their situation just becomes worse every time. Because I'm a young widow, for example. I don't want to be alone. Maybe I have 2, 3 children, and somebody is looking like they may want to take over that responsibility. And I accept only to be abandoned. And then I try again and I'm abandoned. So my social, economic, health outcomes are not likely to be better. They'll get worse over time just because I'm trying to find a place or someone to lean on. That's my take.
Yeah, and you're both on point, JJ, on the issue of young widows and the vulnerability around that, and Charles, as you're expounding more on culture and the ways in which even how we perceive widows and think like they are prostitutes or prostituting themselves. There's a lot, I think, that links to the idea of stigma that others have raised, that you are pointing at, Charles. And Fiona has said something here which is also interesting. Caregiving and being the breadwinner, too much preoccupied for self-care, neglecting own health. Fiona, that's an important point, because sometimes also for widows it's sort of like, I have to be the mother and I have to be the father, and oftentimes you lose just sight of your own self in the process, on how to care for yourself, care for your own health. In my organization, sometimes we joke and say, do you even know what rest is? And then you try to tell them like, how about you just go and sit still and not do something? And they're like, I don't know how to do that, because they feel like they have to be moving all the time to make their world make sense, and in terms of providing for their children and all of that. And Solomon says also lack of motivation or encouragement, maybe from husband, which may lead to fear. Yeah, lack of social support, Solomon, your hinting at that there, also does have a way of impacting mental health and health. So all for such active participation. And just to now, sorry, somebody saying something? So to just build up on all that you have said, so we shared, Rhoda shared with us a survey on widow, what does it mean? And And a couple of us, the idea was just to look at the word itself of widow and explore what is the meaning of these, kind of the surface level meaning, and then what are the social meanings for it, especially when we look at the literal translation of the word. And so I wanted to share with us some of the responses that came out of that survey. So a couple of you completed the survey. So here we have on the right, kind of the language, that group that was represented, and then the term for widow in that language, and then the literal translation for it, and then your comments on how widows are perceived or treated in your community based on the language group indicated. So we had Luia Bukusu Namulehwa. I probably am not pronouncing that well, and the literal translation for that is the left one. And their widows are perceived as weak, insecure, denied property ownership, mistreated by in-laws. There was also Rabai Mujane, but there wasn't enough responses for that in terms of perception and the treatment. But for the literal translation, Mujane only meant woman whose husband has died. Then there were a lot of responses on the Luo category, Chiliel. Some people literally translated this as wife to the grave. Some other people translated it as wife to the funeral. Grave and funeral being kind of separate things. Anyway, so there's just a lot to reflect also on the translation itself. But if we look at the perception of widows in the Luo community, helpless, needy, incapable of taking care of property, self or children, unclean, sex objects or starved. I think, Charles, you are hinting at all of these, prostitutes, carriers of bad luck, harassed, humiliated, segregated, disrespected. And by the way, these were just the words that the participants in the survey used. So I just picked the words as they were and just put them here. Blamed for the death of... yes, Charles, is that you?
There is a particular word there, the unclean, that is so strong within the Luo culture. So it has a lot of connotations. You cannot carry or hold another baby. You cannot enter into some part of a house. It's associated with either bad luck or death is moving around you until you are cleansed. And the cleansing, again, is usually through, having another husband or being inherited. And of course, that propagates, these are the social and health impacts. Please go ahead.
Yeah, thank you for highlighting that, Charles. Disowned, disinherited, devalued, discriminated, property of the clan. Another category for Luia, we got 2 responses from Luia Bukusu, and then I don't know which specific category this one is, but the term for widow is Mukunza Kali, and then the literal translation is dead wife. I do want to also note that for all of these, we've not hit saturation in terms of what's the actual literal translation. It's just from the few responses, sometimes just one person. That's sort of what we have in the survey. And then here it's like widows are respected, which was different from what was coming out from other respondents. There is high expectations for the widow to care for her home, often with minimal support, and this can result into trauma. So there's a way in which you're also left alone in a sense. Then in the Kalenjin community, the word is mosortet, and then it just means a woman whose husband has died and has not remarried. So that not remarried is part of the definition. And some of the words in terms of perceptions were stigmatized. And then respected so long as they respect themselves. So that is also loaded whatever, with meaning there. But anyway, so these were some of the responses that that came out from that survey. And I had done a similar kind of survey before too in 2020, and I started to put together responses from other language groups that were not captured here. For example, in Kisii, the word is omoboroka, which means homeless, the one who lacks home. So again, what is the implication? I think when you think about the literal translation of these words, then we ask ourselves the question of what is the implication of thinking about a person from that perspective as homeless? Why should she be homeless if she's been living in this home for all this time? Or oops, going ahead of myself. Or what does it mean to refer to a woman as wife of the grave? So those are the things that I wanted us to reflect on in terms of our own culture, our own words, and our own language. When we refer to widows, what do those words imply? And is there a way in which these words are shaping how we are treating widows in the community? But if we put all this together, it brings us to this idea of widowhood stigma, and Craig and Sherry had mentioned it. And so the question is stigma just one of the reasons for the poor health, socio-economic outcomes for widows, or is really stigma for widows as the root, as a fundamental cause for the poor health, at least for the health disparities we've seen, the poor health outcomes? So as Rachel said, I'm a PhD student at Maseno, and this idea of female widowhood stigma is the core of my research. And so the rest of the discussion is focusing on the conceptual framework in my PhD work, which goes around trying to understand widowhood stigma better, so that hopefully with that we can have a way of intervening in ways that can hopefully make real or transformative changes in the lives of widows. But now the hypothesis is, and go with me through this journey to see if these hypotheses make sense, and feel free to critique it. It's part of my PhD work and some of the papers I'll be writing, but that female widowhood stigma is a fundamental cause for the health inequalities that we are seeing and that I've already shown earlier on. So, but before we look at that stigma itself, what is a fundamental cause? So important for us to understand that. So there are many theories in terms of understanding stigma, and fundamental cause is another theory. And you can read more about it. It's in the literature. If you just search fundamental cause theory, you'll find a lot on it. But it's a theoretical model that shows how social inequality reproduces health inequality. So stigma is a social construct. And then so how does stigma produce health inequality among in this case among widows, as we are looking at? So in this theory, there are certain social factors that are called fundamental causes. And the features of fundamental causes, one is that they have a direct impact on one's health, behavior, and health outcomes. And two, they reduce one's access to what the authors of this theory called flexible social resources, even financial resources. So they reduce your access to wealth, to income, to education, to relationships, to social support, or even your ability to deploy those resources in order to avoid being sick, or to receive care, or even to adopt healthy behaviors. And then the other feature of a fundamental cause is that they impact the outcome here, health, through multiple pathways. So they impact health through multiple mechanisms, which means if you intervene on one pathway, you still have the other pathways open, and the same social factor will still keep leading to those poor health outcomes, even though you have you are intervening on one pathway. So some of the fundamental causes from this theory include socioeconomic status, racism, and stigma, which there's a paper about stigma as a fundamental cause for population health disparity that the same authors, Link and Phelan, published in 2013. So for those who are curious, you can find that and read more. And so I'm gonna skip that and go to this first. So stigma as a fundamental cause, I'm borrowing a lot from Link and Phelan's work. They are sociologists, and there are multiple definitions also of stigma, but the one they use, which I'm also using in my work, is the co-occurrence of labeling, stereotyping, isolation, discrimination, and loss of social status in a context of unequal power. And so the 2013 paper that I said, where they described stigma as a fundamental cause for population health disparities. And yeah, so for example, HIV stigma can have direct impact on your health behaviors and health outcomes. Like, for example, you don't want to go to health facility because the health workers are stigmatizing you. So then that means you're not getting the care you need. Also reducing access to flexible resources. If we continue using HIV stigma as an example, we know that there's an era where if people knew you are HIV positive, they would not employ you. Thank God we've overcome those eras. And of course, there's a lot in that history too. But also then, the stigma reproducing mechanisms of social disadvantage that entrench health inequalities. So let me try and maybe illustrate this a bit with this graph. So this graph comes from the same paper I referred to that we published just this year on Shamba Maisha, and we were comparing health outcomes between widowed and married women who are HIV positive after an agricultural intervention. And one of the outcomes that we looked at was enacted
commercial ships, trapped since the full-scale invasion, as well as for grain and agricultural produce.
Okay, I hope that person is muted. So the y-axis is the stigma scores, and higher scores means, experiencing higher levels of stigma. And then the y-axis are time periods in which these, while the intervention is going on and in which these, the stigma is measured. So you can see that for the green and orange, points are for widowed women, and they start around the same place, just before 1.2 stigma scores, and the trend is not the same. I think for the control you're seeing a faster reduction in stigma score, but they end at the same place in terms of widowed women in the control and intervention. At the 5th month, they've had a reduction in stigma, and they are at the same place. There's not much difference in intervention and control in terms of stigma scores after the intervention. But when you look at married women, you see that the married women in the intervention start with the highest experience of enacted stigma, the brown line graph, compared to the blue, which is the lowest at the start of the intervention. And there is not much change in stigma scores for the married women in the control, but there's substantial change in stigma scores among married women in the intervention. And eventually you find that the intervention had more significant effect in terms of reduction of experience of enacted stigma for married women as opposed to for widowed women. And so some hypotheses for that can include, for example, maybe the widowed women are experiencing multiplicity of stigma. In this case, it wasn't just HIV stigma is what was being measured, but maybe there is also the widowed stigma that is not being measured, that is impacting their lives. But alternatively, one could also say, if we borrow from the fundamental cause theory, that, well, this intervention impacted on one pathway, which is food security, you could say the poverty pathway, but then there were other pathways that were open: social support, other pathways that stigma does impact life through that were not intervened on, and maybe that could be part of why there is less change for widowed women. So we've looked at that. So for my work, this is the conceptual framework that we are still developing. I'm still developing with my mentors, but the idea is that to hypothesize widowhood stigma as a fundamental cause for the risk, HIV risk behaviors and poor health outcomes for widowed women. So I would like to walk us through this framework, and please feel free to critique it, to suggest how to improve it, how to clarify it. But I'll start first of all, because it's still a framework under development. I'll start first of all by looking at widowhood stigma. So applying the socio-ecological model and trying to understand stigma at different levels. There is individual level, interpersonal level, and then structural level. And at structural level, I know some of us can share more into this. Somebody said catch-22 when it comes to remarriage for widows. So there are norms and practices that limit widows' freedom or constrain widows' options or choices in remarriage. We also do have biases in property inheritance laws. So for example, in Kenya, widows have access, they call it a life interest. So if your husband dies and you had a property with them, you only have access to that property for as long as you stay in that family. If you remarry to another family, you lose your rights to that property. There is no such bias or discrimination for widowers. A widower will remarry and they lose nothing in terms of property that they may have had with their wife who is deceased. So there is that aspect of the laws and some of the cultural practices that drive this widowhood stigma. There is the interpersonal level, which some of us has already mentioned, how widows are labeled. And we did also in that survey, unclean, prostitutes, all of that. And those labels, the separation that sometimes, or rejection that widows may experience in their families from in-laws and all of that. So those are some of the interpersonal level in terms of the experiences of stigma. And then there's also the individual level. Widows can resist the stigma, but they can also internalize the stigma and end up thinking of themselves the way the society perceives them. So, you are a social burden, you are helpless, those words that were coming out from the survey, you're needy, you're incapable of taking care of yourself and your children. So all of these are some of the drivers of the stigma widows experience. So I know I've talked for a while. So thinking about how we are trying here to conceptualize the widowed stigma, does anyone have thoughts? I'm opening chats to see if there's anything in the chats. Oftentimes there's also the different, so in this part of the framework, we have like both the drivers of the stigma and also the manifestations. And so manifestation sometimes it comes in the types of stigma where we have self-stigma or perceived stigma or enacted stigma, which I showed you as a result on. But there's also secondary stigma, which is stigma that other people experience because of their association with widows. So for example, widows' children may experience a stigma because of the stigmatization of their mothers. All right, any thoughts? So this is now the how I'm trying to conceptualize widowhood stigma and the drivers and manifestation. And then how does this lead to the health disparities we were talking about? So from the survey that we did, that the words that people are using, so this stigma, and also attaching it to the fundamental cause theory. So there is access to resources. People talked about property disinheritance, financial insecurity for young widows, and even for all widows in terms of caring for your children, housing insecurity, especially if you're evicted from your home, food insecurity. There's also access to relationships. So the low social support when you're rejected from. So these are going to be like the experiences that a widow, because of their stigmatization, they're going to go through these experiences, which then can lead to other experiences such as sexual exploitation. So for example, a woman who is financially insecure is more likely to take part in sex for fish. For those who are coming from the lake, I know we've heard about this phenomenon of jaboya around the lake region, and some of the women who get trapped into these economic systems are women who are vulnerable, who are financially vulnerable, and widows tend to be a good number in that category, or even transactional sex. So you can see how access to resources would lead to sexual exploitation or even risky sex. For example, opting for female sex work as a way to care for family. And then this stigma also will impact this, will impact the health behaviors here, like through either directly or even through these means of reduced resources, reduced social support, reduced autonomy at the social level. At the individual level, you'll find that for things that widows have control over, and this one we also kind of saw in the Shamba Maisha study, that for outcomes that they had individual control over, they did fairly well, but for outcomes that were dependent on their social environment, then those outcomes they did poorly. And again, going back to stigma driving that. So then access to care too. We've talked about how if you know that the health worker would stigmatize you, you may not seek care when you need it. And then of course, this is increased sexual exploitation or risky sex or limited access to care, and the ways also in which stigma has direct impact on mental health in terms of depression, suicidal ideation. Alcohol drinking is also a very big phenomenon we are seeing, even with our work with our organization, and seeing some women, just because of all the trauma and everything else that is going on, just using alcohol as a way of escape. Then this would lead to poor sexual and reproductive health outcomes, like transmission of STIs, sometimes even unwanted pregnancy and abortion when you think about reproductive health outcomes, and even poor morbidity and mortality. So this is how, in my work, we are trying to conceptualize stigma as a fundamental cause for, in this case, we use sexual reproductive health outcomes as one example of poor health outcomes, but we have seen up there also issues of disability, and one could explore different kinds of health outcomes. And then the other thing also to think about is what could be moderating factors also in terms of the relationship between widowhood stigma and health disparities. So JJ and I had conversations around issues of, for example, religiosity. If we give an example of Christianity, it can be a protective factor, or it can also exacerbate the experience of widowhood stigma. I know some of you might have examples for this. So you may be in a religious community where, because of your widowed status, the community comes around you, provides social support, I probably even financial support. There are religious communities with such programs, but you could also be in a religious community which, because of your widowhood stigma, you're still because of your widowhood, there are sanctions that the church may have, that, or your faith community may have, that may worsen your experience of being stigmatized. For example, there are churches where they say if you're a widow, you are not allowed to be inherited. You cannot do the cultural aspects of remarriage, and this puts young widows in catch-22, as somebody said earlier. Or sometimes they tell you, oh, if you have a widow inheritor, then you will not take Holy Communion. So the religious community adding into the stigmatization of widows. So there's also intersectionality of stigma, which we mentioned a little bit earlier in terms of HIV stigma and then widowed stigma. What about if a widow is childless? I think in some of the survey we did, other things that came up were also like, if you are the type of a child you have, do you have a son, do you have a daughter? In some communities, that also changes how a widow is treated. So I think up to that point, I just want to pause for a few minutes and see just what thoughts people have on this framework for thinking about stigma as a fundamental cause for poor health outcomes for widows. Any thoughts?
Jackie, first, this is Sherry, and sorry, I'm not in front of my computer. I had to be in transit for the last half an hour, but I, first of all, as you know, think that this is really, really important work and really novel. So very much hope you are publishing this really important framework. I think the hardest part in general with these frameworks is the complexity of the factors and sort of deciding on the number of pathways, for instance. And I think the way you've done it is really good. And there's many ways one could do it, because, like, as you point out, all of those factors can contribute together and separately to both access to care issues and to poor mental health. And then poor mental health is a driver of sexual violence and risky sex. Lack of access to care is a driver. And so just figuring out the number of pathways, and that it's just one of those inherent challenges in that things are always more complex than what we can pictorially describe. So I think that the way you've done it is a great way. And, there could be refinements. One of the things that sometimes I think about in this case, when they're so complex, is if there's sort of a broader theory that could help you make those selections. So that would be one thing. And I know that has influenced your choices, but, you could further clarify that, when you write that up. The second thing I would just say is it may be helpful to separate out the drivers from the manifestations.
Okay. Yeah. Thank you, Sherry. And I know I have access to you, so I will chat more with you on that and how to separate them even more clearly, and whether there are aspects of this that might not show up in the framework itself, but it becomes something that is discussed. So thank you for that, Sherry. And Anke, you're saying, are there other individual resiliency factors such as support group, adult children, education? Yes, I think those ones, I'll have to think about how to add them into the framework, either as confounding factors or as moderating factors. But I agree with your comment, Anke, to think about these other factors, especially adult children. It's an interesting situation because having adult children means they can support you economically. But then sometimes it also means like, especially if you have adult male children, Eric Genga probably can say something to this, and they might also be more controlling in terms of what choices or what decisions you make, because again, culturally, they may feel like now as adult male, they are now the head of the home and not their widowed mother. So there are many nuances to explore. Then Charles Luanga says, may also become victims of rape, sexual exploitation. Oh, from some fake pastors. Yes, Luanga is pointing out the ways in which really, being part of a religious community through, fake pastors might also impact the health, the likelihood of experiencing more abuse and exploitation. And then Thomas says, I echo Anke's concern from the concept. I assume that the widows you are working with as super resource poor and in underprivileged society. Am I correct? And then I'm going to answer that, Mawara, and then you say, if not, like Anke, I expect some resiliency factors, especially adult children and or job stability. It is true that this framework, will probably, in terms of the different pathways. So one thing to notice about stigma is that it operates in different pathways. And so what we are seeing from, again, not from a research perspective, but from a work perspective, is that even a very well-educated woman who is widowed, there is that pathway of disinheritance that she's not protected from. And what happens that she will have more resilience in the sense of maybe she has resources to go seek justice, and maybe she knows, she's aware of like how to address those situations in terms of seeking either legal support, but from the experience of more of like, oh, your brothers-in-law are taking away the property, it doesn't matter how educated you are. And so that is sort of some of what we've been seeing from the women we are working with, especially when it comes to issues of property disinheritance. So anyway, anyone else who have any additional comments on this framework, please feel free to tell me you want to chat more about it. I would like to talk more with Anke and with Mawar. Anke, you have your hand up?
Yeah, I'm not an expert, but I know resilience research is very big and a lot of new trauma research. And I think eventually, probably in your research, you want to develop solutions at some point, right? Like where does this go? So I think thinking carefully about the moderating factors and the different facets you see there and how they can work either ways. I think that to pay careful attention to this might set you up for developing solutions and resilience factors down the line. So there is research done in that I am not that familiar with, but I think it might be worth just checking out if there's anything that could contribute to your work here.
Thank you so much, Anke, for that. I will look into those areas more. So yeah, and I think that's a good segue to finalizing these, Anke. Like, are there solutions, or is this health inequality inevitable for widowed women, and what can we do to improve the health situation of widows in Kenya? I know because of time, I'm just going to share a few thoughts from what's coming out from the research I'm doing, and then open it up for final thoughts as we close. But there is the aspect of evidence, and oftentimes widows studies focused on widows are only qualitative. There is a lot to learn from that, and I think now there's an opportunity to build it up from what the qualitative data say? Can we do more large sample studies among widows to estimate the prevalence of stigma, of other health issues, so we kind of also can quantify the burden of the problem. Then there's also the policy environment. I think we are in the sustainable development goals era, and even SDGs didn't have the word widow in the whole report, and this has been a feature of a lot of women's development reports over time. And but then last year, the UN agency the Assembly produced a report last year on addressing the situation of widows, which also talked about the need to be specifically mentioning widows so that we are paying attention and we're not making them invisible in our data and in our reports. And then there's also a chance for, at a community level, practice level, to tailor programs, services to be more sensitive to the experiences of widows. And of course, there's aspect of the narrative, the stories we tell about widows, and how those stories the way those stories have such stigmatizing elements in them, and how we can destigmatize our own storytelling about widows. We started off when I shared I'm part of Nyanam, and we work with widowed women, and there is opportunity. Let me try and move to the next. Let's see. Okay, this one is not working. So so there is the organization I lead and work with, we have multiple programs for widows in different areas, as being shown here. There's issues of land rights, housing securities, mental health, micro business, agriculture. And we think because stigma is acting on so many different pathways, we need to intervene across different levels from where we are. But I just wanted to say also that we do have opportunities for students who want to volunteer, want to do their master's research projects on this population, and have put their organizational email address for those who may want to explore more on this topic or do more research with this population. There is definitely so much to learn and so much to figure out when it comes to widowhood and issues of health and health outcomes, other social outcomes, other economic outcomes, which all align with our goals for the SD4H Forum in terms of sustainable development, thinking about sustainability and development in our interventions. So I know I've rushed through these last parts, but I did want to just share that and see if people have any thoughts. I'm seeing some things in the chats. Yeah, Sherry says, very much agree that adding resiliency factors important to highlight strengths and identity solutions. Thank you, Sherry. And then Robert Bonyo says, very educative. Is there something you found about life expectancy among widows and widowers? Robert, maybe that is something you can pick up. As a study, there's so much that is missing in terms of data. But oftentimes there's something called the widowhood effect, which impacts widowers more than widows. That once a spouse dies, especially for those who are older, you find that if the widower is older, they oftentimes die sooner after, like within 2 years and something. So you can read, Robert, you can read more about widowhood effect, and you can think about a study on that area in terms of comparing the life expectancies for widows and widowers. Can remarrying solve the vulnerability among widows? Open question. Can it? I don't know. That's a big topic. Robert, again, something worth exploring further. And then Rogers says, informative. Thank you, Rogers. And I just want to end, because our time is over, by saying, well, the death of a husband may define and defines a category of a widow. Female widowhood has more social and cultural meanings beyond the death of a husband, all of which have implications on the health and well-being of widows. And then at individual level, we can change our own perception and treatment of widows in our families and communities. But then there is more work needed in terms of structurally addressing the issue of stigmatization of widows. And I hope that my work, our work, those who are interested in this field can really contribute to that goal of having communities in which widowed women, widowhood does not mean vulnerability. It can also mean just a stage in life where still a woman can thrive. And that's it. And I hand it over back to Rachel.
Thank you, Jackie. You're an inspiration to us all. That was beautiful. I learned a lot, but I also am inspired by you. So thank you for all that you do in your research, and also for the women and widows in your community. So thank you very much. We'll be reconvening in 2 weeks' time to talk about a different topic. It's reproductive health and climate change is going to be the topic 2 weeks from today. Thank you for everybody's participation today, and welcome. And very big thanks to Jackie. Great job.
Thank you, everyone, for all the kind words. I'm seeing them in the chat.
Thank you so much, Jackie. That was excellent.
Asante sana, Dr. Ndunyu. Dak is saying, never looking at marital status the same again.
Oh, yeah. Thank you, Jackie.
Thank you. Thank you, everyone. This was a joy to put together, also a learning experience for me to put together. And yeah, I was happy to do it. So asante sana. And I don't know, Rachel, is Rachel gone? Because somebody was supposed to get the book. Rachel, who do you think gets the book?
Oh, that's a good question.
I vote for Craig.
Craig already received one, so I don't think he will get two. But the book is called Redefining Resilience in Widowhood, and it was done by some of the staff at my organization, and it's a collection of stories of widows demonstrating both the two sides of the coin, both the vulnerability, but also the resilience and the contributions widows make. So, Rachel, you might need to tell me who to send one book to.
Okay, will do. And if other students would like to present their research on this forum, please reach out to me. We'd love to have, it's a great opportunity for sharing your work and also gaining important skills as a facilitator and a speaker. So we'd love to have you and give you some time to present on this forum.
Yeah. And then, Rachel, are you able to download the chats? Because I think probably the things I may have missed there that I would want to go back to.
Sure, I can do that.
Thank you so much. All right. Thank you, everyone. Kwaheri.
Thank you.
Bye.
Bye, everybody.
Bye-bye.
Bye.